Some cases don't require hands-on adjustments, old-fashioned chiropractic adjustments. We have small instruments in the office that we sometimes use. This is one of them here. It's kind of a spring-loaded instrument, very gentle, very easy, but it kind of gently taps vertebra back in place. And it just gets placed along the spine, and we make an adjustment to a person's spine, various levels. Maybe if you have someone who's nervous, or maybe if you have someone who's osteoporotic, meaning osteoporosis, maybe this might be an instrument that's used to make alignments with patients. We also have another instrument here. I'll just show you. It's basically a similar type object, but it more runs on a cord, and it's just gently placed against the spine, and things are just gently tapped back into place. Works well for certain conditions, works well for patients who maybe won't enjoy the popping and clicking.